Welcome, Smile Mentor family. Matt Griffin here, your Smile Mentor. And today we are in our appointment series, and now the majority of the funk is out of the way, although this video does have what it looks like with after 9 months of healing, all the osseointegration, meaning the implant adhering, the bone and implant infusing, if you will, and solidifying, giving it that proper substructure. And now that I've been in these temps for 9 months-ish, almost a year, now they wanted to go in and had to rescan the gums because the gums aren't in the same position they are the day of surgery. They had to rescan any bone structure, all that kind of good stuff, see with the teeth in, see with the teeth out. You're gonna see some pretty crazy technology, even some stuff that I was blown away by in that was new in the last few months that they had put in the clinic. So I think you guys are gonna see how cool technology can be for this customization of the smile. And big reminder, don't shortchange this. If you're new to the Smile Mentor, or this is the first video you're watching with us, our heart is for the patient and to get the smile done right. You've heard me talk about it in videos in the past. I have had a serious disdain for the dentist in the past. I'm gonna skip all that because you can read about it in the or watch it in the Smile Mentor description. But this is one of those areas that when people chintz or they don't invest in technology or really in their patients and just give a one size fits all and don't take the time to do some of these extra steps, God, ask this up front while you're doing your homework. What are all the steps I'm gonna have to go through? What technology do you use and why do you use it? How do you know how to use this technology and apply it to me personally? So that being said, hope you guys enjoy this video. If you're a subscriber, I wanna say thank you. I appreciate it. And I'm going to say a future thank you to those that have yet to subscribe because I know you will. Appreciate you guys. Thanks for following us. And here's to smiling. Have a blessed day.
Let me check, Matt, 1 second. Okay, I'm going to scan your teeth, I'm going to scan your bite, and I'm going to scan your soft tissue, and I'm going to scan your implants.
Okay.
So I will have all the info, digital info with that.
For crafting the final prosthesis?
Yes, the purpose is that we're going to have all the information we need to redesign your new set of teeth, because we need to do a new design based on the new position of your gum. And then we're going to make a PMMA, that's like a trial PMMA or a mock-up of the final design. You will try those for 2 weeks, and then if everything is good, we just press start to start fabricating the new set with the final material. Okay, same design, different material.
So come back in 2 weeks, I either give thumbs up and say
but
yes.
Today, come back in 2 weeks to deliver the new set. Okay, because we need
to
to
PMMA.
Yeah.
Okay.
Yeah. And then 2 weeks after that, thumbs up or call, we're good, everything is good, just proceed.
Okay.
Yeah.
Perfect.
Okay. Open.
Does that show if you have stuff in your teeth?
Not really. We can see if you have some, I don't know, food or debris in between your teeth. But here, what I'm trying to do is just to copy. It's like exactly like the impression that we... Yeah.
But it looks highly detailed, so
yes, of course, yes. You can see those details here too.
That's crazy.
That's it. Now I need to remove it, okay? Let me know if you have any discomfort. Okay, good, you're good?
How clean?
It looks very good, yeah.
So when you do this, how often do you see debris and food up in?
Lots of time, and mostly with these temps, because remember that when we deliver those, your gum is in one position, and then 3 months later, your gum is in a different position. Everything is shrinked, so usually you have a lot of space in between the gum and the prosthesis. So depending on the hygiene protocol of the patient, you may have a lot of debris and food, you know. But I mean, you cannot lie to me, you know. Some people say, no, I clean 4 times a day. Maybe not the right way, you know.
Right.
Yeah, so we know immediately if you're doing a good job or not, you know. Yeah. Now I'm going to scan the implants with a photogrammetry system. So we use a different kind of abutment. This is a different type of scanning abutment or okay, stay there. That's it. That's it, man. We just need to wait for your teeth that we're scanning in the lab, and we're good.
First time I've seen that.
Yeah.
Tell me about it.
So that's the extraoral scanner. So we are going to have the coordinates of your implant position. So that one we're going to use just for the position of the implants. The other scan is for your bite, for your gum, and for your teeth. And we merge all the information, and then we have everything to deliver it. So imagine that we may have inaccuracies with the intraoral scanner, sometimes 100 microns, sometimes 200, 300 microns, okay? With this one, we have, the accuracy is like between 10 and 15 microns. So the prosthesis and the fit and the passivity of that prosthesis is super good always, you know? If you have a little bit of discrepancy, it's not going to be like the other one, 300 microns that you cannot seat the prosthesis, okay? So we go for the, no risk, we go for the photogrammetry for those type of multiple implants scanning.
Does it show any of the integration side or just?
Actually what I did today, of course I checked the x-rays and then I removed the prosthesis and I torqued all the implants to 30 newtons, okay? So if the implant is not osseointegrated, it's going to spin, okay? So I know that your implants are solid because I torqued them to 30 newtons. I mean, the abutment that is on top of the implant, the multi-unit, I torqued. So if the implant is not as integrated, it's going to spin. So in your case, all of them are good. Okay?
Good.
I mean, clinically, so we have the evaluation in 3 different aspects. Clinically, visually, so you check if you have an infection, the gum, how it looks, etc. Radiologically, so we check the x-ray if we have any bone infection, whatever. Okay, we see any gap in between the bone and the implant. And then manually, that we torque them, so if the implant is loose, it's gone. Okay?
Perfect. I was telling Dr. Ratana on, while he was doing this is a little like when you get a colonoscopy and filming that, because it is fairly humbling, but yet I really do want you guys to see the whole process. I remember walking in on some clients that we got to know. They're in this position and it's awkward. I guarantee you if you're watching this, it's awkward, but it's worth it. It is, but want you guys to see the whole process. So good, bad, and ugly. Let's get back to it.
Let me put your teeth back and we're done, okay?
Okay.
We can keep it here if you want, but... Sorry, I'm going to squeeze a little bit your gum again, okay, man? Sorry. Bite. Good. That's it, man.
So no cavities in it?
No cavities, man. We just did a cleaning on you.
Right?
We took it out. And...
Yeah. Do you autoclave it?
No. Because we scan it. You know, we scan it just to have information, because sometimes in these cases where all the implants are loaded, I just scan that just in case I need to merge files. So this is a digital craziness that I have. So I scan your teeth just in case I need more info for the implant position and to be able to merge files, okay?
Okay.
So of course, because they need to scan it and put that into the scanner and all that, we clean them. So we use Meticide, all these antiseptics and disinfectants and all that.
Nice.
Okay.
Smells like an Andes mint. You know what I'm talking about? The little square mints, those chocolate ones? Okay. Okay, so since we're continuing on, God, it's crazy how much teeth affect speech. You don't ever think about that. You don't realize how much your teeth affect your speech.
100%.
Until you don't have them.
Yeah.
So next step is you guys are going to design the PMMA or the temporary set.
Yes. Yes. Now I have the new information of your actual of your actual situation of your gum. Okay.
Okay.
And the implants. So, with this information, we're going to design a new set of temps that will be completely, well adapted to the new position of your ridge and gums, and then we'll try those. They will be the same PMMA. We print them. If everything looks good, your bite is good, you like it, we just proceed to do the same design with the final material.
Okay. Does, I know I've talked to, as we've gone around and talked to a lot of different clinicians and patients. I want to congratulate you on these temps that we've done, that I've had for 9+ months now. Awesome. They really are. I've gotten a lot of compliments from doctors looking at them and go, "Who did your temps?" So,
perfect.
Good job on that. But Now, my question, you know, how does when you move from this point going forward, do those temps, do they perfectly mimic what the final, even though it's just a different material, they would be exactly the same, just a different material if I gave a thumbs up on the PMMA, correct?
Yes, ideally, yes. Okay, the only difference is that the final material is not a monolithic material. So sometimes most of the clinics or other practices, they design this in PMMA and then they just mill the same in a monolithic material, usually zirconia,
yeah.
okay? But in this case, we redesign a little bit because we do like a inner structure. Remember, like the polymer structure, yeah. And on top of that, the crowns or the little 3-unit bridges. So they need to do some changes in the design, you know. But basically, yes, it's exactly the same. Actually, we're going to follow this because you like this and everything looks good. So we're going to follow this teeth design. We just need to readapt everything to your new position of the ridge.
Okay. And does it, what should I expect from going from these, understanding I'll have a PMMA something interim from these to the final, but what should I expect from a difference moving forward?
Not much. Actually, you may feel a little bit more pressure on your gums, of course, because these ones now you have a space. And the next set is going to press a little bit more because it's going to be well adapted to your new gums. That's the only difference.
Will it be harder to clean because it's tighter to the gum?
A little bit more, yes. Yes, because of course, if you have a huge space, 4 millimeters, easy to clean. Yeah. But if you have more space, you may have air passing through and it's going to affect your speech.
Yeah.
It's going to affect, I mean, of course, you will have more food packing in between teeth and gum. With the other ones, you may not have food, but of course you still have bacteria that is micrometric, so you need to clean the same. So sometimes we think that because we're closer, it's clean, but no, it's not clean. You still have bacteria, and bacteria is the one causing disease to your gums, to your bone, etc. So you need to clean. And the tighter the space, the more difficult to clean, of course. Yeah.
So hydrogen peroxide, good or not good?
Hydrogen peroxide is good, but in this case, you need to mechanically remove the plaque. Okay, so of course the water pick is a very good help, but you still need to use, water pick, or if not, we use some special flosses or special micro brushes that you can just brush around your implants. Yeah.
Or do the water pick if that.
Yeah, most of the patients, they only do the water pick. Okay.
Well, I would fall into that category.
Yes, but if you can mechanically remove the plaque with this type of micro brushes, it's super good, you know. We all recommend to floss daily. Not all the patients floss daily. I'm talking about natural teeth. No, I'm talking about natural teeth.
Okay.
You know, so of course, we always recommend you need to floss once a day at least.
Right.
Nobody does that. Yeah, okay. But I need to tell you, yes, water pick is super good, and the sensation of using the water pick because you remove those big chunks of food, and all that is good.
Yeah.
But it's not enough. Okay, so I always recommend to be able to use the little micro brushes. We call it interproximal brushes, or those types of little brushes that you can clean underneath. That's the best way to do it.
Okay, I've been doing this for years now with a lot of different surgeries and follow-ups and talking to a lot of people, and this is the first time I'm hearing about this. Where do you buy them? Where would you get these little brushes?
Every pharmacy. You have so many different kind of micro brushes, you know, but we call it interproximal brush. And you have different shapes and tips, you know, so it's super good to use it. Yeah.
Huh.
Yeah. This is the mechanical way to remove plaque.
Okay.
Around your implants, your teeth, you know?
Okay.
Yeah.
Good to know.
Yes.
Awesome. Anything for me? Any suggestions? Do the gums look good? Am I cleaning well,
Yes,
honestly?
sir.
I mean,
everything looks good.
Okay.
Your teeth were super clean, so that's
okay.
Good progress. Very
Perfect.
Good job.
Okay.
Okay, that's it.
Thank you, Dr. Adana. Yeah, it's COVID, right? We're done with that.